welcome. For those of you who weren't in the last session, my name is Michael Greatorex. I'm the chair of St George's Kidney Patients Association and will be your host today. I'll also present a little bit related to PatientView, but for those of you who are not familiar, your screen will now switch to a presentation, and I will either disappear from view or will appear in a small box in a corner of your screen. So hopefully you can see this presentation. So just a few thumbs up for those on video if you can see that presentation. Thanks, Amma. Okay, so today's agenda, we're going to be looking at PatientView, and Patrick, if you just want to wave, Patrick, or say something, then it'll switch to you.
Hi everyone, how's it going?
Good, good, thank you. And then Helena, who's with Dr. Buller at the moment, will join us to say a few words on the renal diet and answer. Then we'll look to answer a series of questions which I've collated from everybody. So thank you very much. It really helps.
So Helena is here. Helena, do you want to say hello?
Hello.
Hi, Helena.
Hello.
So your questions are so important to getting these sessions right. So I really appreciate those that you've sent in. And as last time, we'll try and do a quick poll. I will explain how that works. I was a bit rushed last time, and some of you struggled with the poll, I believe. And as I did last time, I'm very happy to stay behind and have any conversations, so you can give me some personal feedback or whatever after the meeting. As I did last time, the most important thing you must understand about Zoom is the mute button. As you will be able to tell, with 30 or 40 participants, it's a real challenge if somebody takes it off mute. And last time I think we had running water contributing to the color of the presentation. So familiarize yourself with the bar at the bottom of your PC, or if you're using an iPad, it will be at the top, or if you're using a phone, it'll be at the bottom. And these are three examples of the screens, and the two key, and that's all you really need to understand, the two key controls during this meeting are mute and start or stop your video. If you're on the phone, you can use *6 to mute and unmute yourself. The second thing to remember is that during this presentation, there are two ways to view this. One is called gallery mode, and the other is called active speaker. The best way to watch this today will be on active speaker view, because if I'm talking, then you will see me full screen rather than watch a view which you can see on the right hand side. And to activate that again, you'll see a little button in the top corner that will allow you to switch between the two modes. Okay, and then finally, what I found last time was very effective for most of you who were comfortable with this is, if you want to ask questions as we go along, the simplest way to do that is to put that into the chat screen. And again, if you look at the bottom here, you'll see the chat bubble there, and you can, if you push the chat button, you'll see a window appear with your ability to chat, which you can see in the bottom right hand corner there. You can also see who's talking and turn on and off different controls on the right hand side here. And finally, if you're trying to type your message, it'll be in the bottom right hand corner. This is a PC view, and the tablets actually pop up a new screen. And finally, as I said before, it's helpful if you try and avoid talking across people the Zoom conference call gets a bit confusing for viewers when they're switching screens as people talk across each other. There is also a raise your hand feature if you look on the bottom, and that will allow you to raise your hand and say, I'd like to ask a question verbally, although you can just unmute yourself and try and speak as well. Finally, if you want to ask questions but are not comfortable with the chat, in the top right hand corner you'll see the email address of the charity and my mobile phone number, so you can either text me or send an email question if you're not comfortable with the chat function. Okay, so Patrick and I are going to first of all address the issue of PatientView. I'm going to give a quick overview of the system and how as a patient I use that, and then try and answer questions either as I go or as you ask them, or those that I've missed at the end. So if we get straight into it, this is on the left hand side, the home screen for PatientView. So if you type in the address in the top right hand corner here, patientview.org, you will find this website. And basically PatientView is a way to view your test results, particularly your blood test results. It also provides generally the ability to see your letters and medicines, although I'll talk about the implementation in George's and the fact that that doesn't actually implement letters at the moment. It also can provide information about your diagnosis and treatment. It allows you to set up alerts so that when new test results appear, you can be alerted to that fact. It allows you to monitor symptoms so that you can keep on top of a particular issue or condition that you're tracking. And you're also able to download those records for either sharing them with other people or perhaps to do your own manipulation. Finally, you can view PatientView from anywhere because it's on a website, so you can do that whether you're on a holiday or at home. And you can also do that from different devices. So you can do it like I'm showing here from a PC, but you can also do it, as you can see in the image here, from a mobile phone or a tablet using either Android or Google Android or Apple. If you're not registered, and I assume most of you are, but if you're not, the process has been significantly simplified. And now basically Patrick and RJ will receive an online request that they hope to process within 24 hours. And this is the information you need to provide. So pretty basic. As you can see here, if you drop down this specialty menu, you will see that there are, although it was originally designed as renal view, so for kidney patients only, there are another couple of, or three in particular, specialist disciplines. If I remember rightly, IBD, heart failure, and diabetes. But those are only supported in a very small number of units around the country and not at George's. So bottom line, simple to join. You can opt in and opt out at any time, but it is definitely an opt-in thing, so you don't automatically get this. And you can request that other people get access to this patient information, such as a GP, a relative, or a carer.
Yeah, thanks for that, Michael. I was just going to say as well, yeah, so obviously we'll try and get back to everyone as soon as possible, but on weekends, of course, we're not going to be
Yes.
we're not going to be on our desks, but the main thing is you guys know we're here if there are any issues, if anyone has any problems logging on. I think we'll have our details probably put in the chat at some point during this, but also it'll be on the PatientView website if anyone needs to get hold of us or anything.
Terrific, yeah. Thanks for that, Patrick. So this, once you log into PatientView, you'll see this is your home screen, and you'll see the key part of this, and for the majority of people, the reason they log in this to see their results, and you'll see where I've circled here the results tab, and so if you click on that, you will go to the results, the latest results that you have, and I'll take you into that a little bit more in a moment. The other key area which isn't implemented at the moment at George's is the letters function. Sorry, did somebody want to add something then? Okay, so thirdly, if you look at the bottom here and off the bottom of the screen, because this is only the top part of it, you will see that there is an alert function, and this alert function allows you to choose what blood tests you want to be told about when new ones arrive. So, for example, if you choose to be told about your creatinine level, if you select that below, then you will be alerted when a new creatinine test result is available. And you can choose how to be alerted either by email or by this system. You'd also see that occasionally we do put information up from George's. This is something I put up, or got, should I say, got Patrick's predecessors put up for me, just encouraging you to register with us. But there are potentially other news items that George's could put on here. You can also see that research projects are advertised here. So in this case, if you have IgA nephropathy or HSP, and also nephrotic syndrome patients that were both invited to join trials through this system. And finally, as Patrick mentioned earlier, you can either contact Patrick direct and RJ directly by email, but also there is a secure message function here that you'll see at the top of the screen, and that secure message function allows you to send messages that are protected to select people at George's, and I will be talking to Patrick after this about who the right people are. So, but at the moment, the main people that you're likely to want to talk to that are set up are the administrators. So if you have a problem with the system. So let's just get to the meat of it. So if you click on the results tab, as I mentioned earlier, then you'll be presented by this screen. And just to emphasize, this is a web browser view, a PC view of, or a Mac view of the system. And as you'll see, this is, it automatically goes to the latest results. So you can see here, there are, it looks like 8 results. In fact, again, I've taken the top half of the screen, and if you scroll down when you're on a live system, you'll see all of these other results. So in my case, you can see it, you can only see up to HB, but you'll see there's white blood cell, bicarb sodium, glucose, all these other ferritin, iron, all these other recent tests are further down the page. You'll also see this view chart capability, and I'll show in a moment what that does, but it actually allows you to look at all of your historical results for this particular, in this particular case, creatinine, as well, both in table and in graph form. The About Test button you can see above every result allows you to understand or describes the test, and in some cases provides more information about things like the normal range for that test, and other information relevant to the particular test. There's another feature here which I'll talk about a little bit more, but is you can actually enter your own results. Now you might think, why might you want to do that? Obvious examples are things like if you want to track your weight and your blood pressure and other basic observations that you might be doing at home. If you're on home dialysis, you can enter your blood results and various outputs from the dialysis machine on this with this function, and you can also enter basic blood tests, UNE blood tests that you might have had done at the GP in order to consolidate your results. And finally, I had a question from somebody about can you download these? The answer is yes. And in the PC example here, you'll see this button export. If you click that button, it will allow you to download a file. The file is what's called a CSV file, but the main thing is it's easily read by lots of applications, particularly a spreadsheet if you want to share that. If you put it into an email or something like that, it's a little bit unstructured, but that allows you to download it. So let's look at it. So if you select, as I said on my previous page, the view chart button for any of your results, you will come to this screen. And here you can see how you can track the progress of this particular result, in this case, creatinine, through history. So you'll see each of these on the right-hand side. Each of these are the historical data, and you can scroll down. You can see here the scroll button, scroll down, and in my case, there are about 12 years worth of results on the system. Yeah, maybe not as much as that, but basically as many years as the renal unit has for you. On the left here, apologies, on the left here, you can see how you can graph this, and you can manipulate your graph. And really the best thing to do is to play with this yourself, but you can see how you can select the range either by entering dates up at the top, or you can see this gray area underneath, and you can slide this bar across to move the period in time you're looking at, and you can stretch the period by using these little markers here and here. And finally, you can also decide to, if you're trying to understand the relationship between different blood results, you can also compare. So for in this case, creatinine, I could potentially compare, say, so how is my creatinine level comparing to my tacrolimus level? So does the level of TAC in my system affect my creatinine level? There are other comparisons you could choose to do. Correlation between my iron levels and my red blood cell count, or HB levels. If you look at, again, on this page, you have this About Test button, which you had on the previous, and again, that gives you an example or gives you information about the specific test. And finally, if you want to get more help, there is actually a user guide with a number of videos at this address here, and when I share this presentation afterwards, you'll be able to find more information on that. As I said, you can access PatientView from web browsers, and everything I've shown you today is that, or you can download the app. If you choose to download the app onto your phone or onto your tablet, it's going to look something a little bit like this. So this is my iPad image. So this is the home page. So as you can see, it has very similar functionality to the PC, but there are a few things it doesn't have. So it doesn't have this general news thing that you saw previously. It doesn't have hospital contacts, which were available on the PC. It doesn't have the research links, and it also doesn't have the ability to upload home dialysis treatment data. But it does have notifications, and it's very simple to set up notifications on this. And you can also upload media. Now you might ask, why would you want to upload media? So by media, I mean a photo or a video. So this allows you to upload to hospital staff secure information, unlike an email. And so that's a potential for future improvement in our interaction with the hospital, because you can do that in a secure manner. And the graphing is slightly different. Again, I don't have time today to show you how the graphing works on this, but because it's an interactive device, you can, do the usual finger movements that you would on a touch device to open, expand, or contract information. The other critical thing that the mobile devices, the phones and tablets allow you to do is to look at your results offline. So once you've connected to that, it stores your information on your device in an encrypted manner. And so if, for example, you go to an appointment at the GP, or you happen to be in the meeting with your consultant and wanted to ask a question about particular results, you can obviously do that. It also allows you to, if you're not great with passwords, allows you to use your fingerprint or recognition if your phone or tablet supports that. And they're developing this more and more. So they're looking to try to input blood pressure results from photographs, and they also are trialing a diary for patients with nephrotic syndrome, which is under pilot at the moment. So you're going to see more function coming to those devices. And so I've talked a lot about what's there. Let me just finish then by talking a little bit about how I use and see a patient using PatientView. The obvious thing is to be able to look at specific results the sort of the next day, depending on cutoff. But you can also, I think, track a particular health condition, for example, anemia. So when I was on dialysis, was as anemic, and I wanted to know where I was all the time on that. You might also be tracking your glucose levels, or if you've got a new transplant or declining transplant function, you can track that as well and see whether or not things are trending in the right direction for you. I personally think this is a really important tool in helping you take control of your own situation. So as I said earlier, you don't have to see this as just receiving information. You can also see it as providing information to consolidate for yourself a full health picture of you. So as I said, things like weight or blood pressure, glucose, pulse, all these different results can be added in there, as well as information from other sources. The other thing that I like to do, and I found particularly useful when I was on dialysis, was to look at all of my latest results before I went to see the consultant, and allowed me to be better prepared prior to the clinic to ask the right questions about my health. And I think the other thing is it's a great tool for sharing information. So as I said on a couple of occasions, it allows you to unify both GP and renal unit test results if particularly in the current environment, you're getting tests done at a GP. It allows you to, if you move units, for example, if you go from George's to, I don't know, somewhere in Birmingham, then it will keep that historical data. So in my case, I had information at Epsom St Helier, and then that came across to, and then I can consolidate that and see that as well as my data from St George's. You can obviously, if you're in a GP appointment and they want to ask you how things are doing and they don't have access to your latest results, you can show them. And as I said at the beginning, it doesn't have to be you who's using this system or has access. You can also let a relative or a GP have access as well, in order to, so they can be reassured or help you with understanding your condition. Okay, so that's all I had to say about that. Let's move to some questions, and hopefully I've been able to answer most of them. Specifically on the renal and gastroenterology teams rather. Basically, as I said at the beginning, you can only view what's available on the system. And at the moment, gastroenterology at George's, there isn't any facility for them to upload data. Clearly, if they take any blood tests or anything like that, then that would be available. But at the moment, diagnostics, endoscopic information and so on is not available on the system. There was a question about export. I did show you how to export that data. As I said, if you're using the mobile device, you don't necessarily have to export it if all you want to do is show it to a person on a one-off occasion. But if you want to, it will download something that will load easily into spreadsheet, and it just looks like one big table. And then somebody, as you can see at the bottom, made some comments. Are there any other questions that you have? Let me just have a quick look here.
Also, if I can chime in as well, I mean,
yeah, please,
if anyone in the past here has used it before as well, I mean, I think that's particularly from my perspective, I'd love to hear about any issues you may have had with it. If you've used it before in the past, decided, you know, it's not working for you, I'd love to hear anything like that, or anything we might be able to work on to make it a better product for you. I'd be really interested to hear that as well. I think James mentioned something with, about text-to-speech technology. This might require a further discussion, James, but I think as Michael's shown you, so I think the interface is pretty much, it's a lot of clicking, apart from putting in your username and your password at the beginning, and I think they'll have a little drop down to enter secret characters for a secret word. Once you're in, I don't think that you really need to use much of a keyboard. I think it more is just about clicking on different charts, different results.
Paddy, some of our patients are partially sighted or even registered blind.
Right, okay. Obviously, it's a visual interface that we're using. I mean, obviously that probably would be quite a barrier. I don't think there's much we could do in terms of that, but no, yeah, I'm afraid if they did have severe vision problems, I'm not sure what to suggest on that one.
Okay, maybe that's something you could take away and explore with the developers on that.
Sure, definitely, I can write that in my notes now.
Hi, can I just say something? It's RJ here. Hello, everyone. It's good to see you all. Very familiar faces. So, yeah, we'll explore into text-to-speech function. I'm on PatientView now. I'm trying to search if there's something available, but I cannot say at the moment. But if you or anyone is having problems logging in, please feel free to contact me. I'll give my number. You can call me anytime and I'll support you on if you're having any issues to PatientView, especially the transplant patient. I know how important this is for you. I remember the times when you used to call me to get the results. So I think this is another way that you can check your results without calling the clinic, and you can take more control of it. Thank you.
It's just worth noting that the time it takes to get results on is usually the next day, as long as your blood results are on the St. George's system before the evening run. So basically what happens is once the results are on the St. George's system, at night there'll be a run which copies information from there to PatientView. And so if you're on late, it's like dialysis, you'll likely miss the next day or the overnight run. So it's probably 36 hours before they'll appear. But otherwise, it'll be next day for most patients.
Some people have highlighted the fact that they come through the early hours of the morning, about 2 a.m., 3 a.m. I'm afraid that's the way it is for the meantime. And one of the reasons why they come through at such ridiculous hours is because they have to go through checks. So they're exported from St. George's to a central database, and then they're thrown out from that central database. And I think the reason why they've chosen that time is so that they come out for the next day. But I do want to implore all of you, please don't wait up till 2 a.m. or 3 a.m. waiting for the results to come through. Just take it that they're coming the next morning.
Yeah, they actually, one of the reasons they do it is because they don't want to impact the live system. So they want to put a load on the system overnight when people aren't using it.
And if there are people who are having problems with their login, please use Patrick or RJ's email address and just highlight to them. They have tried to sort of like send out passwords to people again, but if you in particular are having any problems, they're going to leave their email addresses on the chat. So please do feel free to contact them. And also, some of you might want to learn how to do some of these things that Michael has described. So once again, they're happy to support you in this.
Thanks a lot, Joyce. I'll put our emails in the chat right now.
Okay. Okay. So I don't know whether whether you can still see these questions. Helena, are you there?
Yes, I'm here.
Super. I'm not sure how you'd like to start off, but just let me know, and I guess with an introduction, and then tell me what you'd like me to do.
So Helena has emailed some slides to you.
Yes, I
just
have
some things that she'd like to highlight.
Yeah, I can share those when you're ready. Vitamin D.
Well, I just thought because you hadn't, hello everyone, I understood that there weren't many questions, so I thought I'd put up a little bit about vitamin D, just because it's been quite topical and it applies to kind of most of us really. So I've sent Michael some slides just to talk a little bit about vitamin D for your.
Well, let me know when you want me to show those.
No.
Do you want to do that first, or do you want to do that first, maybe, and then we can, and then maybe people can think about any other questions they want to ask. There I am.
Okay.
Can you hear me clearly through the mask?
I can, yes.
Oh, good.
So just while you're loading up the slides, I mean, there are some questions here.
There's one question that is very specific and quite specialist about an eye condition for somebody who's obviously struggling with that specific query, which I don't think I'm going to answer to today, but it might be something that somebody wants to discuss with their eye specialist, and they could maybe contact us later or afterwards if they want to discuss it further, because I think it's very much to do with the eye rather than the kidney side of the diet. Shall we talk about vitamin D now, and we can go back to that and give you a chance to think of any other questions, if that's okay. So as I said, I just thought I'd put it together very quickly when I understood there weren't many questions. I just put some information about vitamin D together. So if I can have the next slide. So just really, I'm sure you're all really familiar with vitamin D. It's been mentioned a bit through the COVID pandemic, but it's just to remind you, it also plays a big role in the care of kidney patients. It's the vitamin D that we've been talking about is very important in bone health. And the main source of vitamin D for most of us is by the action of sunlight on our skin. Can I have the next slide? So if you think about the diet though, there's two main forms of vitamin D. So you may hear about vitamin D3, which is also known as cholecalciferol, and that's the one that's primarily recommended as supplements. And there's also vitamin D2, that comes from plant sources and fortified foods and thought not to be as potent and effective as a supplement, but it does work. Sorry, next slide. So here it's just a bit more information about sources of vitamin D. There are very few sources of vitamin D in the diet really, but some of those are, the main sources are really where we have supplemented. Things like margarines are good sources of vitamin D just because they have added vitamin D in. Otherwise, those people who don't really like oily fish or liver are kind of, you know, really that's why sunlight is the main source. Can I have the next slide? So just I thought it might be interesting for you to see just a range of vitamin D content of different foods. So you can see that cod liver oil is an excellent source of vitamin D, but we often advise people with kidney disease against having cod liver oil because it's also very high in vitamin A, and vitamin A can collect when you haven't got perfect kidney function, and that can be damaging to your bones, so it can actually cause bone breakdown. So we definitely advise people not to have any fish liver oils for vitamin D. Fish oils, fish muscle oils are different. So this is just really fish liver oils like halibut liver oils and cod liver oils. Because of the vitamin A content, they can be dangerous. And then you can see other sources again, that's the oily fish and the supplemented dairy products mainly. Thanks very much. Next slide. So when we talk about making vitamin D from the action of sunlight on our skin, that's all well and good, but we live in a very northern country. Although we don't often notice it, we're actually, because of the effect of the, because we're a relatively warm country, but actually because of the latitude of the UK, we can only make vitamin D with sunlight on our skin between October and April. And even in the summer months, you can only make it between 10 AM and 3 PM roughly. And if you have any darker skin tones of skin, you'll need relatively longer exposure to sun to make vitamin D. And if you're using sunscreen to block the sun damage from sun, then obviously that reduces your ability to make vitamin D. And obviously a lot of us are, you know, very careful with sunscreen, especially if you've had a transplant. You know that you have to really minimize your exposure to the sun. So that really applies to many people who are conscious about the damage that sun can cause to our skin. Next slide. So there's a wide range of people who are actually at risk from vitamin D deficiency. So this applies to the general population and people with kidney disease. So everybody in the UK between October and March, you can't actually make vitamin D from sun. So if you haven't built up enough stores in the rest of the year, that can be a problem. And this year, particularly, a lot of people have been, you know, very much inside. So a lot of people won't have had much sun exposure because everybody's been inside, especially those of you who've been shielding and particularly careful. And anybody who is outside, but as I said, takes care to avoid sun exposure or isn't generally covered up. So if you generally cover your skin for any particular reason, if you have darker tones of skin, you will be, or you may be at risk from vitamin D deficiency. And people who are particularly overweight can have low vitamin D levels. So next slide. So this is just some data looking at the sort of vitamin D deficiency in the healthy population can be as much as 50%, and people on dialysis and with kidney disease can be a majority of people. So it is very, sorry, I had a call coming through. And that's associated with a whole range of conditions as we find more about vitamin D. And it has even been mentioned in relation to the risk of COVID, the risk of becoming ill with COVID. So it's next slide. So just to give you an idea, mean daily intakes in the UK are around 2.8 micrograms, and the requirements are supposed to be about 10 micrograms. So again, just to point out that we don't really get much from the diet, and it's worth you know, considering if you're in that high risk group, then you know the general advice from the government is to take a 10 microgram supplement. Certainly throughout the winter and maybe through the summer if you're in that high risk group. You should inform your doctor that you're taking those vitamin D supplements, and if you do think that you need a higher dose supplement, then obviously speak to your doctor before you do that.
Next slide, please. Next slide, please.
That's it.
That's it.
Okay.
Now, if there's any questions from that, then I'll be happy to take them. And Dr. Pakula is here as well, in case there's a medical query. Should we go back to some of the diet questions that were submitted?
So there's a question here that says, I hardly eat meat now, but do eat high protein yogurts, nuts in diet. Should I be taking iron supplements? Can iron be low if HbA1c is okay?
So the answer to that is that the iron status and the HbA1c wouldn't be particularly related, and it is quite difficult to test exactly what's going on with the iron status in the body. Often in the unit, people test the ferritin level to assess whether that there is a need for iron supplementation. So that's the standard method that people look at, or your doctors will be looking at to assess whether you've got enough look at your iron status. It's not a perfect method, but it is something that they use clinically. The question of iron supplements is interesting. In the past, everybody was advised to take iron supplements orally, but generally now, if you do have a low iron status, most people are advised to take an iron infusion to boost your iron levels. It is difficult to if you don't eat meat. I mean, as you say, the person who put the question is quite right that the meat is the best source of iron and the best absorbed. If you are if you don't have any other constraints on your eating, then things like dried fruit, nuts, pulses, dark green leafy vegetables are also really good sources. But you may, from your, I can imagine that people out there are thinking, well, some of those foods I can't eat because they're high in potassium or they're high in phosphate. So for those reasons, we don't often talk about a high iron diet for kidney patients. And also there is it is difficult to absorb iron, and probably more so if you've got kidney disease. So that's why we don't advise against avoiding red meat, because it's such a good source of iron. But if you do need iron supplements, it's something that your doctor may talk with you about, having an iron infusion rather than any change in your diet, particularly, other than a good, healthy, balanced diet.
Is the clinic continuing to do regular checks on iron and cholesterol levels? Unfortunately, we were asked not to do them on a regular basis, and I think it was partly costing, but we're trying to re-implement that, because we're seeing that when you don't do these things and monitor them regularly, that often they end up getting to such a point that they need more being put in place in order to replace. But in GP practices, they do check the cholesterol, but it's on an annual basis. And then there's another question for Helena. Do foods such as soya or hormone treatments, for example, HRT, affect progression of kidney cysts? I think I'm going to answer that, actually.
I'm glad she's going to answer that.
I'm going to answer that. So there are some cystic kidney diseases, like polycystic kidneys. In terms of HRT, we have found that estrogen tends to affect the proliferation of these cysts. This is quite a specific question. So what we find is that women, during their periods when they're menstruating, the cysts tend to get bigger during that period. And then once they reach the menopause, often the growth slows down. That's a very specific question. There's another food question here.
Oh, there is, yeah.
About low potassium.
So there's somebody who said that they find a low potassium diet challenging. I'm sure most, many people do. And there was a few strange suggestions as to what one can eat on the printout. So it's donuts and what's-its. So those are down, because we don't expect everybody who's on a low potassium diet to be also eating the perfect diet. And there may be some people, I don't know who they could be, that might like things like chocolate cakes or dry or fruit cakes or those kind of things. So if somebody who really desperately needs a cake in their life or a sweet treat, and you're looking around for low potassium ones, then something like donuts is much lower in potassium than, say, a chocolate cake or a fudge cake or a fruit cake. So it's not a perfect diet a solution, but it is something that's a real world solution. So people often need or feel that they want sweet treats, so we're just giving a lower potassium version. And the same thing with what's-its. Obviously, no one's recommended what's-its as a perfect food, but if you're thinking about what a snack and you're desperate for a packet of crisps, and what's-its would be a lower potassium alternative. They're not good in terms of nutrition or in terms of salt, but they are lower in potassium. And then they also mention looking up levels for certain fruit and vegetable items on the internet helpful, and trying to compare one fruit to the other, and lists would be useful. So anything like that, if you are struggling with a low potassium diet or a low phosphate diet or want information, we always put our numbers and contact details on the diet sheets, and we really would be delighted if you give us a call and let us know that you want a bit more information, because we do have access to lots more other information about these kind of things. So if you do use us, we put our number on for a reason, that we really do want you to call and question us and ask us different things, because we know how difficult it is sometimes to get information about kidney and diets, especially for you particularly, because everybody's so different. So do just call us and say you want some more information, you want this particular information, and we're really, really happy to discuss it with you and send off information or point you to other sources. So that's a great question. Thank you very much.
Okay, so there's a whole bunch of questions around going back to work, around shielding, etc. And I'm going to try and pull these questions together in groups. So first of all, I want to remind everyone, please get your annual flu vaccine, because you can imagine during the last stocktake, it was on the tail end of the winter. And unfortunately, some people ended up with both COVID and flu. That could be devastating. Please get your flu vaccine. And they're starting out this September. Now, in terms of going back to work, there are some buzz terms that I want all of you that are thinking or that are in the process of going to work, I want you to be aware of these terms because your employers are aware of them. First of all, ask your employers, will my workplace be COVID secure? So that's one term you need to find out from them. And then the other question is, what about my access to work? So in terms of this terminology, COVID secure, so there are 5 steps that the government has put out there to working safely, and your employers are aware of these. So in the first instance, every workplace needs to carry out what we call a COVID-19 risk assessment, making sure that things are safe for you as an individual and the workplace in general. The second thing is that there needs to be proper amenities for cleaning, hand washing, surface cleaning, sanitizer being available, adequate washrooms. So 1, the COVID-19 risk assessment. 2, proper cleanliness and available amenities for you to keep clean and your colleagues as well. Then the third thing is help for people to get to work. So being at work is one thing, but look at your pathway to work. Do I have a means of getting to work safely? Somebody else asked about public transport. If you are going in public transport, then you do need a mask or some kind of facial covering that will cover your nose and your mouth. So if you're going to work, you want to be in enclosed spaces for the minimum. If you can take the bus, it's probably better than being foisted in the underground for prolonged periods of time. If you've got the opportunity to walk, wherever you can walk and keep your enclosure with people to a minimum. If you're sat in the tube or sat in a train or sat in a bus, make sure you're socially distanced within that area. And then the last thing that one needs to think about is social distancing within the workplace. Now, I know people have been banding about whether it should be 1 meter or 2 meters, but at the moment, the government is still saying 2 meters. So particularly if you're in an office where you'll be in close contact for prolonged periods of time, make sure it's 2 meters. And you'll notice that myself and Helena, we're socially distancing. And while you're in the enclosed office as well, wear your mask or your facial covering. And the nose and the mouth must be covered. And then just some little rules of thumb. Not everybody's going to be carrying tape measures and rulers all about, but 2 meters is roughly 3 steps. So if you bear that in mind, there are some more questions about, okay, it's starting to rain, it's getting cold, we can't keep meeting out in the garden. That's true. So if you're then having meetings indoors, I don't know how big your individual homes are, but the government's talking about 6 people at the most, particularly if you're not in the same household. And ideally, if you're meeting inside, it should not be with more than 1 other household. And then the other thing to bear in mind is that when you're in that context, like if you've got people coming over to your house, get them to wash their hands as soon as they come in. Have hand sanitizer around. And regularly, like if you've got little children playing on the floor, teach them to use hand sanitizers. And then there are some other things, like some people, as we're coming out of shielding, and the government, I mean, well, I won't make any comments, but it can be quite confusing. So a lot of people, they're suddenly finding that the food packages they were receiving, they're no longer receiving them. So some people are quite vulnerable because they don't have networks. So you can get help from carers. So there are carers that are in place, and now the people that we call NHS responders. I'm going to send some stuff to Michael that he can upload onto the website later. So terminology, there is opportunity to get help from carers. Let your GP know if you're struggling. There is another group of people, NHS responders, who are volunteers. And then do remember the social distancing. So if you have started going to the shops, do remember to keep socially distanced, whatever you're doing. And then there's another group of questions here in terms of, do you have tips on how to maintain both physical and mental good health in the coming winter months? Still, try and make sure you're doing stairs. Try and make sure you're eating healthy. And that's why Helena was here. And I'm hoping that Helena will have some sort of like guides about having a healthy diet, a balanced diet. What we talk about when we talk about the NHS plate, but she'll put some information. Obviously, we don't want to overload you, but if you target healthy eating, what does that mean? Exercise. Please don't just sit down watching telly. Just be conscious. Don't put weight on whatever you do. And I know sometimes it's cold during the winter, but still put your coat on and get out and take a walk. What else do we have here?
I just add something to that on
Yes.
exercise. I posted an article on the homepage a few weeks
Is it
ago.
kidney beam?
Correct.
Beam. Okay, good.
Yeah.
Yeah,
so,
that's useful.
so if you go to the homepage, you'll see an article on kidney beam, and it's an exercise program specifically for renal patients, and
Okay.
sponsored by Kidney Research UK.
Okay, and then there's another question about the vaccine. Well, the good news is that things are moving forward very quickly. I mean, in the UK alone, there are at least 3 different vaccines that seem to be coming through. That's apart from what Russia and France or wherever else are doing in America. But in the UK alone, and actually, I'm pleased to say that St. George's are actually in the forefront. So we're one of the major testing centers. People are asking, like, if I'm immunosuppressed, such as like a kidney disease that requires immunosuppression or a transplant patient, will I be one of the first to get the vaccine? I'm afraid not. And maybe you don't want to be among the first. What they usually do is gone beyond the point of healthy volunteers, just sort of like, you know, when they're initially testing the safety of the vaccine. Now they've managed to titrate the doses, etc. There are several different vaccines, as I've mentioned, even in the UK. So it's going to the next level. Often the time, the people that are used as the next level of guinea pigs are people like myself, healthcare workers. Not that we're dying to get it, but in a way, because we're in the forefront, and also because the people that will have it done wouldn't have underlying medical illnesses. And so it's kind of a safety thing. But then after that, then come the vulnerable individuals, such as people with transplants or immunosuppression for other reasons. And we're trying to put a case forward because within George's, as I said, is one of the centers that are in the forefront of this. So we're trying to put a special case forward for our patients in Renal. Some other questions that are more specific that I know people will be upset if I don't at least try to answer. Can we have a general update about what is happening with COVID at the moment? So the good thing is we're getting fewer cases at St. George's. And you know, St. George's, because of the nature of it, the fact that it has so many specialties, it was one of the favored centers for management of COVID. We have very few cases at the moment, but the hospital is stratified into what we call green, amber, yellow, and even a super green area to determine where patients who have COVID should go and where other patients can go to maintain safety. Somebody else has asked about changes to the system of appointments. I'm afraid this is a process in development. And in fact, we've got a meeting tomorrow where we're going to try and sort of like get things stratified a bit more. Also, we're waiting on a lot of equipment, which we're still waiting for in terms of computers, headsets, in order that we can, and also a video conferencing kind of facility, in order that we can offer you better virtual consultations. So that is work in process. There's a meeting tomorrow, and I'm hoping that there'll be more to share from that. So somebody is asking about, as an AKC patient, about limited exposure to the doctors. So there will be, I'm going to actually take this question to the lead for AKCC, just to make sure that everybody's getting their fair share, as in consultation with the doctor. as well as with the specialist nurses. Another question here, transplant team making greater use of email. Yes, we are. So there's in fact, we'll put the email address for the transplant clinic onto the website so that you know where you can use if you can't get through on the phone. I must say it's still work in process, but we're hopefully going to get it more stratified and more functional, because it's one thing sending an email, but if you send an email, you do want a response. In terms of
also, Dr. Papula, I think it's also about the workflow around this,
yes,
because so many things are changing, different
yes,
work patterns. There isn't a natural workflow and handoff between people. So I think that needs some thought about, you know, if you think about how things are handled in a call center or something like that, they have handoffs and they have service levels and all those sorts of things, which are just not there in a hospital care environment. No,
they're not. And in fact, it might be that we'll be asking for some volunteers at some stage to just help the flow while we just get things embedded. So that's another thing. And then expecting a copy of my blood tests. So we are trying to, but I'm afraid a lot of our admin staff are not able to come on site to work. So there is quite a backlog in terms of the flow of letters. But that's one of the reasons why this evening we've given so much attention to PatientView, because as you can see, that's an opportunity to just see all your results at a spread. Now, there are some people that don't have access to the internet, and no matter what, they're not going to have access. So we're not going to stop sending out the letters, but please bear with us a while we get the flows back. And then somebody's saying, can we have a phone conversation to replace the face-to-face, please? And it seems people overwhelmingly, even if everything's all right, they still want to have a consultation in terms of to explain, and if they've got any other questions. Now, we are going to work hard to get to that point where we can do those consultations. And if there's anybody that feels that they do need a consultation, haven't had one, especially among the transplant population, please send an email into the email address that we'll put on the website. So I think we've touched on every single question that has been sent through, except one, and that is, why does Collier's Wood have no sheets and pillowcases and patients have to lie on damp plastic? So that's something that I'm going to take forward and speak to Dr. Jones, who is the lead clinician for Collier's Wood, and also to our matron as well, to find out what's going on from that point of view.
Yeah, this was sent to me a couple, very quick, when I first sent the invite out. So whether it's still the case, I don't know, I have to say. But okay. It sounded pretty unpleasant.
Okay, so if that person has any more information on that, please send it through on the chat, because that's something Claire will do. I can
provide her details. I'm sure she won't mind.
Okay. Okay.
We've got a few questions that came through on both email and chat. Let me, if you don't mind, Joyce, I'd just like to just address a couple of these on email first. Should we be wiping down all shopping deliveries?
I do. So I'll have to leave you to make your own decision, but I do. And in fact, one of the things that is good to do is to leave them just sat there for a while before popping them into your cupboard and your fridge.
Yeah, that's what we tend to do at home, is with hard goods that in particular, again, you're not going to put in the fridge or freezer. You just stick on the side and leave for a few days.
Well, maybe not days, but I just, depending on what it is. But
okay, I got a question here about having blood tests at a local hospital and emailing the results to St George's. Is there a way they could be added to PatientView, please?
Unfortunately not. And actually what we're finding, the problem with that is that some of the hospitals, they don't have the same speedy processing, and samples are left for a long time. And often the readings are not the same as what we would have got at St. George's or one of our centres, because the transit of the samples. And then another thing that's happening is that some of the centres can't do all the blood tests. So we're only using that as an emergency, and we don't want that to be the default process. And they can't be added to PatientView, unfortunately.
Okay, there's a question here about trying to get PatientView login. I think I addressed that in my presentation, but just as a reminder to anybody who joined late, just visit patientview.org, and in the top right-hand corner, you will see a button that says join, and then if you click on that, it'll ask you to provide various bits of information. Please pay attention to the fact that you need to select St. George's as your unit. I think in the past somebody has registered with another hospital, which also, will give you.
And also, Patrick and RJ. Patrick and RJ, can you say hello to everyone again, please?
Hi, everyone.
Okay.
Hello, everyone.
So these are your resources for PatientView. Okay.
Yeah,
and your emails, have you put them on the chat?
The email should be in the chat. I'll post them again for anyone who's just joined recently.
It is in the chat. It's there, and I will put it in the write-up I do after the meeting.
Okay.
So if I could finally just go to a few questions that are on the chat. Jane was asking about text-to-speech technology. I'd be interested to hear back about that, Patrick, when you've spoken to Jane about that, because I'm not convinced that the technology they're using is very text reader friendly.
No, so because you're going to be accessing it via a browser, that's basically going to be limited to what text-to-speech is built into your browser or to Windows. So I know you can use Google text-to-speech on Chrome. I don't know if she uses something separate, like a Dragon Dictate or something like that.
I think we need to set that offline. But I think fundamentally, yeah, we must follow that up for Jane.
Sure. Yeah, Jane probably has a unique issue or question. So yeah, if Jane's here, and as I said in the chat, please feel free to send me an email.
But I would like to share that with for others as well, if I may. Emma's got a question here about alpha calcidol. Do I need to also take vitamin D tablets if I'm on alpha calcidol? That's
very good question, Emma. Thank you. I should have mentioned it really. In the past, that's really the reason why people with kidney disease don't really take vitamin D3, because in the past we thought not. We thought the advice was previously to, once you're on alpha calcidol, you don't need to take vitamin D3. But it appears that there are some benefits from taking vitamin D3 on its own, and it makes sense to because it's the source of alpha calcidol really in the body, to make sure that you've got adequate stores of that form of vitamin D before or as well as having alpha calcidol. So if you've got good kidney function or reasonable kidney function, and you've got adequate amounts of vitamin D3, it may be that you don't then need alpha calcidol at some point in the future. So it will depend a little bit on your kidney function. Well, it will depend on your kidney function whether you need alpha calcidol, but the advice at the moment is that everybody should also take D3 at least at a small dose.
So it doesn't replace it.
It doesn't replace alpha calcidol, yeah, but it's as well as. Yeah. If you can bear that many tablets, it's worth taking.
Since you're on vitamin D, Jane's asking, is there a recommended way to store vitamin D meds to ensure they don't deteriorate in terms of dosage?
I don't know, but I would assume that it would be in the dark and in a cool place. And the other thing about vitamin D is if you take it, you're supposed to take it with an oily meal, so a fatty meal. So if you, so the advice is really to take it with the biggest meal of the day, perhaps, or your cheese sandwich or something like that, not a low fat. So not your breakfast, which might be if it's skim milk and a cereal or something, but a fattier meal. Yeah, not an empty stomach.
I think,
with the biggest meal of the day.
There's a question here from Sharon about letters to employers. I think you answered this last time, but the question is, will you be willing to provide letters for employers?
So it's going to be difficult if from the hospital we're supplying everybody letters, but I'm going to post or send to Michael some specific information that employers can look at and you can look at, because there's information for the employee and information for the employer as well. In some situations, they may need a letter, but it shouldn't be the norm. Does that make sense?
Yes, it does.
Okay.
Maria is asking about her daughter going to reception, and I think it's the same for all of us with children going starting off at school now. It's not specific what she's asking about, but I guess it's really about should she be going, and if she is, what precautions and so on.
Yeah, it's got to be a judgment call because there's no absolute wrong or right answer here. But one thing we are asking people to do is to make sure you let the teachers know that you, if you are a highly vulnerable person, if that makes sense.
Yes.
To make sure the teachers are aware, because then they can make sure that they take this into consideration when dealing with the children in the schools.
I guess it's much more difficult for a reception club thing, but I certainly know my daughter who's 14, her school is asking that. I've gone back to the school and explained her relationship to me, and as a result, they've said that pupils in her class will be required to wear face masks, which was quite a surprise.
Okay, so above the age of 11, they are increasingly asking the students to wear face masks, but also some schools are making arrangements like where your child may sit, for instance. So it's kind of, it's important to let the school know. And it's a similar situation with the workplace as well. So those terms that I used, COVID secure, access to work, maybe there'll be one that says access to school as well. Okay.
I can see Maria nodding there, so hopefully that's answered her question. Just to re-emphasize, it is kidney beam, B-E-A-M, as in beam you walk along, rather than, or the supports a roof, rather than bean as in baked beans. But as I said, just go to the home page and there's a picture of a lady doing some sort of exercises, and that's the one, and all the details are there.
And a lot of the exercises, you can do them sitting on a chair.
Yep. I think there's a question here from Laura. I think this is just a general theme that I continually get from and see from patients about anxiety, about coming to George's. In this case, it's about a dermatology appointment. Is it safe to attend such an appointment? Well,
so what you'll find when you get there, and dermatology is a good example, that used to be like a crowded marketplace. You'll find that there are much fewer people there, and there is social distancing, the chairs, the areas being marked. What I would suggest is try and get there at the time of your appointment, so you're not waiting in the area for a long period. And where you can, try and ask for an earlier appointment if you can. But the clinics are aware of this. They are social distancing. As I mentioned, the hospital is stratified into what we call super green, green, amber, yellow. So just so that everyone's aware. And you'll notice that everyone goes around with a face mask. And if you're coming into the hospital, please do the same. But it's not enough just to wear it. Make sure your nose, like mine, your nose and mouth are covered.
Okay, thank you. I'll give it a go and see how I feel. Thanks very much. Thank you.
Okay.
Thanks, Laura. Emma was asking about, apart from St George's, which other hospitals link up to the St George's system? You've got saying that Purley Memorial does. Not sure about the Nelsons and Queen Mary's.
So Queen Mary's definitely does. The Nelson definitely does. St John's does as well.
What I can say is, as I was a patient, dialysis patient at Kingston, and Kingston, the bloods go to Carshalton. And so if you get your details registered with Epsom St Helier, so if you have any blood tests with them, that will then be visible on the PatientView system. So it won't be visible on George's system, but it will be visible to you on PatientView.
So that used to be the case, but Kingston, it's coming over to St George's, but it's not quite a smooth process at the moment.
Oh, right, okay.
So it's no longer going to St Helier's.
Okay.
So it's moving to St George's, but not all the results come through still.
Okay, and then just a reminder. There was one about a question that was, I'm just trying to find it here. Some of us want to visit relatives we haven't seen before lockdown, or start relationships. What's the advice on displays of affection such as hugging? I mean, this is particularly important for our young adults, right? I mean, we can't ask them to effectively go into relationship quarantine forever.
No, but whatever you're doing, do it with social distancing. So,
Oh, that's good.
so whatever you're doing, do it with social distancing. And if someone that you're in a relationship becomes part of your bubble, well, so maybe we're going old-fashioned again. So one man, one woman, or two women or two men, depending on how you're doing it. But keep your bubbles small. Keep your bubbles small. In other words, not having lots of different bubbles that you're going in and out of. Because unfortunately, people would have heard that among young people, the rate is going up quite a lot. So it is possible, but that person you're in the relationship with, just be sensible.
I think
if you're that close, you should be able to share some of what's going on with you so that they know that you're vulnerable as well.
Yeah, I think I would say that as I have this conversation with my 4 teenagers all the time, and I think the challenge you have in any new relationship is that they have to understand their responsibilities, and so the question for them is, are they willing to share in that responsibility of keeping you safe by, you know, understanding that what they do potentially has consequences for you.
Yeah,
which is quite a big deal, right? It's a very heavy way to start a relationship, but that's the reality. Okay, I think that's all the questions, and I can see we've overrun quite a lot today, so I apologise for that. We had a lot of questions at the end, and clearly a lot of them are around still around the nervousness with which we all feel about our situation in the current environment. So thank you for that, team.
Thanks for having us, Mike.
You're welcome. So I'm just going to stop sharing this, and I don't think there's anything more, but if I may, I'm going to just put up a poll which will allow you to give us some feedback. I would like to say before I do that, 2 things. One is I apologize for last time. A few of you seem to have a problem with this, the poll. You do not need to do anything but wait for the poll to appear on your screen. All right, so there's nothing technical that you should need to do. If it doesn't appear, then I'm sorry, it's possibly because the settings have somehow been changed on your system to prevent you from taking part in polling, but it should be as straightforward as it should appear. Don't touch your phone or PC until it appears. I'll tell you when I push the button in a moment. Secondly, the poll themselves should be pretty quick, but once that's finished, just a reminder, I'll stay on, and if anybody wants to talk or provide feedback. But the key thing is, a lot of people last time said they were interested in particular subjects, but then didn't follow it up with emails about what they wanted to know about that subject. So I'd really impress upon you, throw anything you want my way about what you'd like to hear about, and just give some substance to what it is. So if you want to hear about, I don't know, transplants, tell us what you want to know about transplants. If you want to know about
transport to even get to the venues, the transport that we have at George's, whatever it is that you want. More about dialysis, for instance, or more about maybe a particular disease, but we don't want it to be too specific so it applies to more people. Yeah, that makes sense. Yeah. Well, we're happy with both, right? But the more general, the better. Yeah. Okay, so I'm now going to launch the polling, and when I do, it should appear on your screen. So all the best, everyone.